Welcome to the RRPS presentation on students with diabetes. This program was developed using Helping the Student with Diabetes Succeed, a guide for school personnel. This was developed by the U.S. Department of Health and Human Services and the National Institutes of Health and Centers for Disease Control and Prevention. Can you tell which one of these students has diabetes? The purpose of this training is to help you recognize the signs and symptoms that a student with diabetes may exhibit when they are experiencing high or low blood sugars. This is the most important thing you can do to help students with diabetes succeed in the school setting. Diabetes management training teaches the school nurse and staff member how to provide necessary care for students with diabetes during the school day and school-sponsored extracurricular activities. Training should occur before the beginning of the school year when a student is diagnosed with diabetes, when a student with diabetes is enrolled in school, or when appropriate. There are two levels of training appropriate for school personnel. The first level of training is for school staff members who have primary responsibility for students with diabetes. Example, teachers and coaches, but who don't perform diabetes care tasks such as blood sugar monitoring, insulin, or glucagon administration. The second level of training is for school personnel who will perform routine and emergency care, school nurses and trained diabetes personnel. This training will serve as the Level 1 training. Diabetes is a chronic disease in which the body does not make or properly use insulin, a hormone needed to convert sugar, starches, and other foods into energy. People have increased blood sugar levels because they lack insulin, have insufficient insulin, or are resistant to insulin's effects. High levels of glucose build up in the blood and can spill into the urine. As a result, the body loses its main source of fuel. When insulin is no longer made, it must be obtained from another source, insulin shots or an insulin pump. When the body does not use insulin properly, oral medications may be taken instead or in addition to insulin shots. Neither insulin nor medications, however, are cures for diabetes. They only help control the disease. The disease can affect blood vessels, eyes, kidneys, nerves, gums, and teeth. It is the leading cause of adult blindness, lower limb amputations, and kidney failure. People with diabetes also have a higher risk of heart disease and stroke. Some of these problems occur in teens and young adults who develop diabetes during childhood. The good news is that research shows that the problems can be greatly reduced or delayed by keeping blood glucose levels near normal. There are two main types of diabetes, type 1 and type 2. Gestational diabetes occurs only during pregnancy and ends after delivery. Women who have had gestational diabetes, however, are more likely to develop type 2 diabetes later in life. Type 1 diabetes is a disease of the immune system, the body's system for fighting infection. In people with type 1 diabetes, the immune system attacks the beta cells, the insulin-producing cells of the pancreas, and destroys them. Because the pancreas can no longer produce insulin, people with type 1 diabetes need to take insulin daily to live. Type 1 diabetes can occur at any age, but it occurs most often in children and young adults. The symptoms of type 1 diabetes usually develop over a short period of time. They include thirst and urination, constant hunger, weight loss, and blurred vision. Affected children may also feel tired all the time. If not diagnosed and treated with insulin, the child with type 1 diabetes can lapse into a life-threatening condition known as diabetic ketoacidosis, or DKA. Although scientists have made much progress in predicting who is at risk for type 1 diabetes, they do not yet know what triggers the immune system's attack on the beta cells. Scientists believe that type 1 diabetes is due to a combination of genetic and environmental factors. Researchers are working to identify these factors and stop the autoimmune process that leads to type 1 diabetes. The first step in the development of type 2 diabetes is often a problem with the body's response to insulin or insulin resistance. For reasons scientists do not completely understand, the body cannot use its insulin very well. This means that the body needs increasing amounts of insulin to control blood sugar. The pancreas tries to make more insulin, but after several years, insulin production may drop off. Type 2 diabetes used to be found mainly in overweight adults ages 40 or older. Now, as more children and adolescents in the United States become overweight and inactive, type 2 diabetes occurs more often in young people. To control their diabetes, children with type 2 diabetes may need to take oral medication, insulin, or both. Type 2 diabetes develops slowly in some children but quickly in others. Symptoms may be similar to those of type 1 diabetes. A child or teen can feel very tired, thirsty or nauseated, and have to urinate often. Other symptoms include rapid weight loss, blurred vision, frequent infections, yeast infections, and slow healing of wounds or sores. High blood pressure may be a sign of insulin resistance. In addition, physical signs of insulin resistance, such as acanthosis nigricans, may appear. Here the skin around the neck or the armpits or groin appears dark, thick, and velvety. On the other hand, some children or adolescents with type 2 diabetes show no symptoms at all when they are diagnosed. For that reason, it is important for parents and caregivers to talk to their health care providers about screening children or teens at high risk for diabetes. Being overweight and having a family member who has type 2 diabetes are the key risk factors for type 2 diabetes. In addition, type 2 diabetes is more common in certain racial or ethnic groups such as African Americans, Hispanic Latino Americans, American Indians, and some Asian Americans and Pacific Islander Americans. For children and teens at risk, healthcare providers can encourage support and educate the entire family to make lifestyle changes that may delay or prevent the onset of type 2 diabetes. Such changes may include reaching a healthy weight and then maintaining it and engaging in regular physical activity. The goal of effective diabetes management is to control blood sugar levels by keeping them within a target range that's determined for each child. Optimal blood sugar control helps to promote normal growth and development and allows for optimal learning. Effective diabetes management is needed to prevent the immediate dangers of blood sugar levels that are too high or too low. As noted earlier, research has shown that by maintaining blood sugar levels with the target range that can prevent or delay the long-term complications of diabetes such as heart attack, stroke, blindness, kidney failure, nerve disease, and amputations of the foot or leg. The key to optimal blood sugar control is to carefully balance food, exercise, and insulin or medication. As a general rule, food makes blood sugar levels go up, and exercise makes blood sugar levels go down. Several other factors such as growth and puberty, mental stress, illness, or injury can affect blood sugar levels. With all these factors coming into play, maintaining good blood sugar control is a constant juggling act, 24 hours a day, 7 days a week. Students with diabetes must check or test their blood sugar levels throughout the day using a blood glucose meter. The meter gives a reading of the level of sugar in the blood at the time it's being checked. If blood sugar levels are too low, hypoglycemia, or too high, hyperglycemia, students can then take corrective action such as eating, modifying their activity level, or administering insulin. Low blood sugar levels, which can be life-threatening, present the greatest immediate danger to people with diabetes. Many students will be able to handle all or almost all of their diabetes care by themselves. Other students, because of age, developmental level, or inexperience, will need help from the school staff. The school nurse is the most appropriate person in the school setting to provide care for a student with diabetes. However, this staff member may not always be available during the school day, during extracurricular activities, or on field trips. Because diabetes management is needed 24 hours a day, 7 days a week, diabetes emergencies can happen at any time. School personnel should be prepared to provide diabetes care at school and on all school-sponsored activities in which a student with diabetes participates. In this case, the school nurse or other qualified health professional should be involved with training of appropriate staff and providing professional supervision and consultation regarding routine and emergency care of the student. All students with diabetes will need help with emergency medical care. Effective school-based diabetes management requires two things. First, all school staff members who have responsibility for students with diabetes should receive training that provides a basic understanding of the disease and the student's needs, how to identify medical emergencies, and whom to contact in case of an emergency. Second, a few school staff members should receive training from a qualified health care professional in student-specific routine and emergency diabetes care tasks. One staff member should always be available for younger, less experienced students and for any student with diabetes in case of an emergency. The diabetes medical community has found that non-medical personnel, called trained diabetes personnel in this presentation, can be trained and supervised to safely provide and assist with diabetes care tasks in the school setting. This includes blood sugar monitoring, insulin and glucagon administration, and urine ketone testing. These non-medical school staff members should be trained by the school nurse or a qualified health professional. Assignment of diabetes care tasks must take into account New Mexico state laws in determining what task may be performed by a non-medical personnel. Collaboration, cooperation, and planning are key elements in developing and implementing successful diabetes management at school. To work collectively, a school health team should be assembled to include people who are knowledgeable about diabetes, the school environment, federal, state, education, and nursing laws. Team members should include the student, parent or guardian, the school nurse, and other health professional, administrators, the principal, the teachers, and guidance counselors, and other relevant staff. Written plans outlining each student's diabetes management help students, their families, school staff, and the student's healthcare providers know what is expected of them. These expectations should be laid out in writing in the following documents: the Diabetes Medical Management Plan, developed by the student's personal health care team and family. It should contain the prescribed diabetes health care regimen tailored for each student. Quick Reference Emergency Plan, based on the information in the student's diabetic health management plan. This plan describes how to recognize hypo and hyperglycemia and what to do as soon as signs or symptoms of these conditions are observed. Education plans, such as Section 504 Plan or IEP, explain what accommodations, educational aids, and services that are needed for each student with diabetes. Other documents may be generated when a school nurse is involved, such as additional instructions to the staff. The Diabetes Medical Management Plan or Student Health Management Plan describes diabetes care regimen developed by the student's personal health care team, family, and should be signed by the student's physician or other member of the health care team. This document is presented in our district as part of the student's 504 plan or IEP. It should contain date of diagnosis, current health status, emergency contact information, students' willingness and ability to perform self-management tasks at school, list of diabetes equipment and supplies, specific medical orders, blood sugar monitoring, insulin, glucagon, and other medications to be given at school, meal and snack plan, exercise requirements, additional monitoring, typical signs and symptoms and prescribed treatment for hypoglycemia, typical signs and symptoms and prescribed treatment for hyperglycemia. The health management plan should be reviewed and updated each school year or upon a change in the student's prescribed regimen, level of self-management, school circumstances, or at the request of the student or parent guardian. The Quick Reference Emergency Plan is based on the information provided in the student's health management plan. The school nurse will usually coordinate its development. The plan summarizes how to recognize and treat hypoglycemia, hyperglycemia, and it should be distributed to all personnel who have responsibility for students with diabetes. The student health team, including the student and parent or guardian, must agree on how the health management plan will be implemented and what medical accommodations, educational aids, and services may be needed for the student. This information might be included in a Section 504 plan, an IEP, or other educational plan. The 504 plan is commonly used for a plan of services developed under Section 504 of the Rehabilitation Act. An IEP is required for students who receive special education and related services under the Individuals with Disabilities Education Act. This information in the health management plan can be used in developing either a Section 504 plan or an IEP, but should not be substitute for these plans. The 504 plan, IEP, or other educational plan lays out what medical accommodations, educational aids, and service the student may need. Diabetes management means monitoring or checking blood sugar levels throughout the day, following an individualized meal plan, getting regular physical activity, and administering insulin and/or medications to help keep blood sugar levels in the target range to help prevent the onset of hypoglycemia or hyperglycemia. Additional elements of diabetes management in the school include planning for events outside the usual school day, planning for appropriate disposal of material that comes in contact with blood, and dealing with the emotional and social aspects of living with diabetes. One of the most important parts of diabetes management is regular monitoring or checking of blood sugar levels. Monitoring involves pricking the skin with a lancet at the fingertip, forearm, or other test site to obtain a drop of blood and placing the drop on a special test strip that is inserted into a glucometer. The meter gives the current blood sugar level. Physicians generally recommend that students check their blood sugar during the school day, usually before eating snacks or lunch, before physical activity, or when there are symptoms of hypoglycemia or hyperglycemia. In young children, symptoms may be subtle. Blood sugar should be checked whenever symptoms are suspected. Many students can check their own blood sugar level. Some will need supervision, and others will need to have this task performed by a school nurse or trained diabetes personnel. Blood sugar monitoring does not present a danger to other students or staff members when there is a plan for proper disposal of lancets and other materials that come into contact with blood. This disposal should be consistent with universal precautions. A disposal container may be kept at school or in the student's personal container, heavy-duty plastic or metal container with a tight-fitting lid. Hypoglycemia, also called low blood sugar, is one of the most frequent complications of diabetes and can happen very suddenly. It occurs when a student's blood sugar level falls too low, usually as a result of administering too much insulin, skipping or delaying meals or snacks, not eating enough food as prescribed in the meal plan, exercising too long or too intensely, or a combination of two or more of these factors. It's more likely to occur before lunch, at the end of the school day, or during or after physical education classes. Hypoglycemia is not always completely preventable, and not all students, especially young children, will recognize its symptoms with every episode. Therefore, school personnel should be familiar with the symptoms and treatments so that an urgent problem can be handled appropriately. Hypoglycemia can impair thinking abilities and sometimes can be mistaken for misbehavior. If a student has a sudden change in behavior, becomes lethargic, combative, or unconscious, or is having a seizure and convulsion, presume the student has hypoglycemia. Treat the situation as a hypoglycemic emergency and contact your school nurse or trained diabetic personnel immediately. As soon as the symptoms of hypoglycemia are observed, give the student a quick-acting sugar product as specified in the Quick Reference Emergency Plan and contact the school nurse or trained diabetic personnel immediately. Severe hypoglycemia is rare at school and generally can be prevented with prompt treatment when early signs of low blood sugar are recognized. When hypoglycemia is severe, the school nurse or trained diabetes personnel must respond immediately. Symptoms may include inability to swallow, unconsciousness, unresponsiveness, seizure activity, convulsions or jerking movements. If the student is exhibiting these symptoms, never attempt to give the student food or drink or put anything in the mouth because it could cause choking. If students become unconscious or experience convulsions or seizures, position them on their side to prevent choking. Immediately contact the school nurse or trained diabetes personnel, and they can administer glucagon if available and indicated in the child's health management plan. If glucagon is not authorized, then staff should call 911 immediately. Hyperglycemia, also called high blood sugar, is a serious manifestation of diabetes that may be caused by too little insulin, illness, infection, injury, stress or emotional upset, ingestion of food that has not been covered by the appropriate amount of insulin, or decreased exercise or activity. High blood sugar symptoms include increased thirst, frequent urination, nausea, blurry vision, and fatigue. Over a long period of time, even moderately high blood sugar levels can lead to serious complications such as heart disease, blindness, kidney failure, and amputations. In the short term, hyperglycemia can impair cognitive abilities and adversely affect academic performance. High blood sugar levels will cause a breakdown in fat, causing ketones to form. Ketones will be cleared by the kidneys into the urine, but if there are more than the kidneys can handle, they build up in the blood and may result in diabetic ketoacidosis. This complication will cause a fruity breath odor, nausea, vomiting, stomach pain, and if untreated, deep breathing and increasing sleepiness. Treatment of hyperglycemia may involve drinking water or diet drinks or administering supplemental insulin in accordance with the health management plan. The nutritional needs of a student with diabetes do not differ from the needs of a student without diabetes. Both should eat a variety of foods to maintain normal growth and development. The major difference is the timing, amount, and content of food that the student with diabetes eats are carefully matched to the action of the insulin. The student's meal plan is designed to balance nutritional needs with insulin regimen and physical activity. The family and personal health care team create an individualized meal plan based on carbohydrate counting and/or exchange system. Carbohydrate counting involves calculating the number of grams of carbohydrates the student eats. This information, which can be obtained from nutritional information on food labels, is used to determine the amount of insulin the student needs to control blood sugar for any given meal or snack. With some insulin regimes, it is important to maintain consistency in the timing and content of meals and snacks. The student should eat lunch at the same time each day. Snacks are often necessary for the child with diabetes and must be eaten to balance the peak times of insulin action. A missed or delayed snack could result in hypoglycemia. The student also must have immediate access to quick-acting form of glucose such as juice, glucose tablets, or regular soda to treat hypoglycemia. The student's diabetic health management plan or education plan, 504 IEP or other educational plan, should show the timing of meals and snacks and an alternative plan for unusual or unforeseen circumstances. Exercise and physical activity are critical parts of diabetes management. Everyone can benefit from regular exercise, but it's even more important for a student with diabetes. In addition to maintaining cardiovascular fitness and controlling weight, physical activity can help lower blood sugar levels. Students with diabetes should participate fully in physical education classes and team sports. To maintain blood sugar levels within their target ranges during extra physical activities, students will need to make adjustments in their insulin and food intake. To prevent hypoglycemia, they also may need to check their blood glucose levels more frequently while engaging in physical activity. Physical education instructors and coaches must be able to recognize and assist with the treatment of hypoglycemia. A quick-acting source of glucose and the student's glucose meter should always be available, along with plenty of water. The student's diabetes health management plan, 504 plan, IEP, or other educational plan should include specific instructions. Meeting the needs of the students with diabetes requires advanced planning for special events such as classroom parties, field trips, and school-sponsored extracurricular activities held before or after school. While there are usually no forbidden foods in a meal plan for children or teens with diabetes, school parties often include food high in carbohydrates and fats. The parents or guardian should decide whether the student with diabetes should be given the same food as the other students or food the parent provides. Parents should be given advance notice of parties to incorporate special foods in the meal plan or just to adjust the insulin regime. Students often view a field trip as one of the most interesting and exciting activities of the school year, and students with diabetes must be allowed to have these school-related experiences. Although it's not unusual to invite parents to chaperone field trips, parental attendance is not a prerequisite for participation by the student with diabetes. Trained diabetes personnel should accompany the student with diabetes and ensure that all student supplies are brought along with the student and that there are snacks and supplies to treat hypoglycemia. The plan for coverage and care during extracurricular activities sponsored by the school that take place outside of school hours should carefully set out in the student's 504 IEP or other educational plan. As with field trips, trained diabetes personnel must be available at these activities.